Good morning everyone and welcome to Baylor Health Services Community Nurses Week. I'd like to introduce myself. My name's Emma. I'm the manager of the Transition and Restorative Care Program at Baylor Health, and I'm here with Molly, who's a third year nursing student at ACU. Welcome, Molly.
Thank you. Thanks for having me.
You're very welcome. So Molly, I just wanted to start by asking, why did you want to be a nurse?
So I remember growing up, I spent a lot of the time in the hospital setting because my brother was quite sick growing up. And I don't know, I just felt really comfortable in the hospital, and I just sort of always knew for as long as I've always wanted to be a nurse. And I just consider myself an empathetic person, I just think I have the traits to be a nurse, and I've always wanted to be a nurse.
That's lovely.
Yeah.
Can you tell me about your experience at Baylor Health Services in community programs during your placement?
So I was here for 2 weeks on my community placement in July this year. I spent time at a variety of places. So I was at HARP with the Continence Clinic, with TCP, at Midlands, and there were a few other places as well, but I did spend majority of my time with HARP, and there I went out to the community, into people's houses, and also in the office doing work there as well with the nurses.
So what was it like for you getting out and seeing those HARP clients in the community?
A very unique experience. I really enjoyed it. It was different to any other nursing I had done. Seeing people in their own environment was definitely something I'll remember.
Yeah, it's pretty special.
Yeah, definitely.
What do you see as the biggest differences between working in the community and working on the wards?
So as I was saying, seeing people in their own environment is very different. The way that they behave just seems they seem a lot more relaxed and a lot more comfortable in their own home, because hospitals can be quite cold and uncomfortable for people. So I feel like you learn a lot more about your patients and your clients when you're actually in their environment. And I remember I went out to this lady's house. We were going there because she was having a few mental health problems and some weight issues, and just you can just gather so much information just by observing the cleanliness of her house and the food that was lying around. You could just sort of paint such a bigger picture.
Yeah, you can. So was there a moment in your placement, so you've had a bit of experience in the acute setting and then you've come out to community programs, when you thought, actually, this is what I want to do. I'd love to work in the community as a nurse?
So I've always considered community nursing, but it's not really offered as a graduate year, so I didn't really think that much into it, but definitely after doing my placement, it really just piqued my interest in community nursing. So was there a particular moment? I was probably the entire experience. And probably the biggest thing was going out to clients' houses. That was something that I just knew I wanted to do. So in my future, I definitely will be wanting to pursue that.
That's
in further studies.
Yeah. So that's my next question, was where can you see your career heading? So if you're looking at community nursing, is there something that is, at the forefront of your mind, whether it's sort of like a district nursing role or more as palliative care or complex care? Is there a particular direction you'd like to go?
I think I like district nursing because I really like that, really honing in on those nursing skills, with the wounds and all those type of things. So definitely will be something in the future.
Yeah. So what excites you about community nursing the most?
Honestly, just the people, the community, being a part of a community, having those people around you, even just being a part of the team. It's so team focused, and getting to know the clients, and Yeah, that's great. And what do you think would be the biggest challenges for you as a community nurse?
So
I consider myself very empathetic, and I seem to build really strong relationships with my clients and patients. So I feel like because you are so close with them in their home, I feel like I would get a bit attached to them.
Yeah.
So I think that I would probably struggle with separating my work life with my personal life. But I feel like that's something I'll practice in the future.
Yeah, and it will come with time and experience.
Yeah, exactly.
What will be the rewards for you being a community nurse?
Probably seeing that all the time that I've put in to see these clients, seeing the changes in them. So when you spend so much one-on-one time with somebody and put like a lot of work in the office and then going out and just seeing changes in them, I feel like that would be really rewarding.
Yeah, very much.
Yeah.
When you think about your future career, what do you want your legacy to be?
I would love to be known as a positive person and a good team member and just fun to be around. And yeah, I hope to inspire future nurses one day as well.
Lovely.
Yeah.
Thank you, Molly.
No, that's all right. Thank you.